Hello, this is Robert Whitaker with Epica Animal Health. Today we are going to go over our fourth case type in our 12 case type series of Epica's HDVI CT technology. Today we're talking about respiratory cases. We're going to identify all the anatomy in the chest in terms of 3D and 2D imaging all the way down to 300 microns. Some of our larger patients, we could go to 600 micron studies. We're going to use IV contrast in a lot of cases, but there are also cases that we don't need contrast in the lungs. The air itself in the lungs kind of works as a contrast on its own. We also have a good map of the respiratory system for surgical planning. So if we are in need of resections or in need of an interventional procedure such as a stent, those can be done using this machine or this machine's images. And of course, we all know that radiographs do not always see everything in the lungs. In most cases, it underrepresents what truly is going on in the lung fields. So we use CT as often as we possibly can when it comes to respiratory cases and respiratory diseases. Our first case today is Cinnamon. She's a 6-year-old domestic short-hair feline. She presents with respiratory distress. A T-fast ultrasound was performed in the lung fields, and of course pleural effusion was discovered. 130 mils was tapped from the chest via thoracentesis. They also performed an HDVI CT scan of the chest with their Vimago GT30, and they used contrast. They sent this to Peregrine Radiology for a radiologist review. They found pulmonary consolidation that could be fungal or bacterial. Without an aspirate, it's difficult to see that, which of those that it is. Of course, there's also some lymphadenopathy going on. The radiographs did not show that, cannot show that. So you can see when you use contrast in a CT study, you can see enlarged lymph nodes. I can see this lung consolidation a lot clearer, and then I can determine, what's going on with this lung consolidation. And then I can also go down here and get a lot of detail out of these lymph nodes. So there's just more detail. It's like using 3D in black and white, and it's absolutely gorgeous what you can get out of your images when you do this. Our next case is going to be Zeke. This is where we get to use the fluoro feature on the Vimago or the Pico. Zeke is an 11-year-old pug that weighs 26 pounds. He's a heavy breather. He's been coughing quite a bit for just over a year. Of course, all of that gets worse with activity. Radiographs were taken, and of course, the only thing they could really see was an enlarged heart in the radiographs. They went ahead with a chest fluoroscopy exam using their Pico HU system. They sent the video of the fluoro exam over to Peregrine Radiology to be read, and they found that, of course, there was a complete collapse of the trachea at the bifurcation. There was also a collapse at the cotylobar bronchi. Now, in a lot of cases, especially with pugs, tracheal collapse is commonly treated using stents. And stents are often put in using fluoroscopy as well. So you're diagnosing and you're also treating using the fluoroscopy on a lot of collapsing tracheas. Now, in this specific case with Zeke, this collapse at the bifurcation and, of course, this collapse at the cotylobar bronchi is not, let's just say that stenting at these locations has not been perfected yet. So there's alternative treatments that are available for Zeke instead of stenting. Our next case is Bam Bam. He is a 5-year-old pit bull. He weighs 49 pounds. He breathes abnormally and he has difficulty breathing, specifically when his activity is increased. At the veterinarian's office, he has elevated white blood cells, and the radiographs that they took indicate that there's a mass in the chest, or could be a foreign body. So they went ahead with their CT scan using IV contrast with their Vimago GT30. They sent this off, the study off to Peregrine Radiology to be read by radiologists. And it comes back for sure a mass in the right cranial lung lobe. And also there are nodules found in these lungs. So this is definitely a situation where we're dealing with some cancerous, some cancer. And of course, in order to confirm that, biopsies must be done. But the images are going to show both this mass and also in not just the mass, but also the nodules. And we're going to see these in our multiplanar review scan with all three of our 2D images on the screen. We often like to thicken, just like we did with Cinnamon's images earlier, to really get a good view of what's going on in the lungs in 2D. We thicken the data set, so we're going from a 300 micron to a 7 or 8 millimeter thick slab. So it's a 3D slab that we're looking at on the screen now in black and white, and it gives us the indicators of where all of our nodules are. 6 cases per full-time DVM each month is what we see on average for respiratory cases using CT. That's $500 for a scan fee per patient. That's to scan the chest. About $3,000 per full-time DVM each month can be generated just from respiratory cases. Other benefits would include your ability to just skip radiographs. You don't have to use radiographs anymore to diagnose chests. You can go straight to the CT to do this, and you can get far better results than what you've been getting with radiographs. Another benefit, of course, is you're going to be able to diagnose these respiratory conditions and the masses and all the little things, the nodules that come with them, with much more confidence. Fluoroscopy exams, not near as common as what we would see with CT exams in respiratory cases. But in those situations where we use fluoroscopy, we're going to be, looking at a possible tracheal collapse, a dog that's coughing, the mystery coughing dog. Sometimes we don't know why the dog coughs. So again, not as frequent of a case coming through the hospital, but definitely about 2 cases per full-time DVM each quarter is our average. And we charge usually $350 for a scan fee for a fluoro exam. So that would be about $700 per full-time DVM revenue for each quarter. Don't forget to go to our website, epicaanimalhealth.com. Learn about Epicare. That's our warranty, service, and maintenance program for the Pico and the Vimago CT systems. Download our CT buyer's guide. If you're interested in shopping for CT, you need to know what it takes to put a CT in your practice. All of these things are talked about in our CT buyer's guide. You need to download that. If you want to learn about CT on a basic level, you can register and take our CT 101 education course taught by our chief radiologist, Dr. Bob O'Brien. If you want to watch other cases like what you've seen today, real cases scanned by real Epica customers, scan this QR code. I have over 100 of these cases that are published on my YouTube channel. Thank you for joining me today to learn about the respiratory cases in our 12 cases series. Have a great day.